I'm Robin Morrison, here with Linda Miles, my co-founder in Oral Cancer Cause, and today we're in the Patient Prism Video Studio, talking a little about Oral Cancer Cause, how we began, where we are today, and where we're going in the future. So to kind of give you a background of why we are doing what we are doing, Linda and I came together to as co-founders of Oral Cancer Cause because we both lost a loved one to oral cancer. And Linda said, with all of our experience in dentistry and our personal experience, let's start something to help raise awareness and also to help these oral cancer patients and their families that are going through the treatment.
Yes.
So with, I lost my brother in 2012 to oral cancer, and Linda lost
My
Charlotte.
sister-in-law, Charlotte, with head and neck cancer.
Right. And so we got very ambitious, and we decided we would go for a nonprofit and put all the work into it. We had a lot of support in the community to get started, and so that's how we became Oral Cancer Cause. So Linda, you want to share kind of about where we are today? I mean, we started with nothing. We worked really, really hard. We got a lot of support from our dental colleagues and our profession, and we built some momentum to where we are now, almost half a decade more today.
Yes. One of the things that has been so instrumental, Robin, is the being embraced by the organizations, the associations that you and I have been members of for years. And another is the dental major meetings offering us complimentary booths this past year has been a tremendous boost for awareness. And even though a lot of people bypass, some of the nonprofit booths, we created, I feel, such a foundation for our next few years of building on that. And it was amazing how many people came by and how many people said, what can I do? I want to help in the future. And we've been invited to more meetings since the first few. So that's very encouraging. We also have the 5K that you have done for the last, this is your third year coming up. And we've had so many of the patients and their parents show up, and so many people in the community that want to support OCC. I think our best thing was you came up with the name of the Bubblegum Challenge on March the 30th, and Oral Cancer Awareness Month is April 1st. So with a 2-day notice, this lady was amazing, and we put out the first Oral Cancer Bubblegum Challenge, which is having bubblegum, sugarless, in the dental practice so that your patients can blow a bubble, put it on social media, and that has been our biggest, I guess, recognition of OCC.
Yeah, I was trying to think of what we can do that we take for granted, which is how we came up with blowing a bubble for those who can't.
Yes.
Because I kind of thought back to people we know
Who
that
can't eat,
speak, drink, swallow, and so it makes something that was such a heavy topic kind of fun and light that would get people talking about it, not burying it.
And they love blowing those bubbles. I mean, some have been on their glasses, their nose, but it's a lot of fun, and it gets the dental practices to realize this is a serious topic. We're doing a little fun spin, but we need to educate our patients more about this deadly disease.
Right, and I think it's such a cool thing for them to do in their community. And you and I talk about marketing and management, the things that we do in our career, but it kind of became a cool marketing thing for the practices because the community responded to this, their patients responded to it, and they were kind of standouts in their area with their practice, doing this type of campaign.
Yes, and we've had health fairs, whereas the community comes out from 11 to 2 with food trucks and bounce houses and for the kids and fire trucks, and the television stations and dentists in the community are giving free oral cancer screenings. The dental societies got behind us in Richmond and Virginia Beach for that a couple of years ago, and it was tremendously successful. And one of the things that I'm also most excited about is asking every dental practice to close the cash drawer, open their front door, and from 4 to 7, pay the team members to be there and have free oral cancer screenings in the community. And patients or the community loves to do business with those who give back. So it's a tremendous service, but it's also a great marketing for the practice, because it's amazing that they do find oral cancer in some of the, or lesions that they send for biopsy, because some of these are elderly patients, some are young people that thought, I've had a sore in my mouth that seems to be a mouth ulcer that I'm going to go have it checked. So it's really important to do things that involve the team and the community and create awareness.
They do. And you know the thing that I have seen happen recently in the last year, because this is becoming more known, the Bubblegum Challenge, and there's more practices participating across the country, is they are now reaching out to us and I have this patient in my practice, can oral cancer cause help them?
Absolutely.
And to me, that's such a win-win.
Yes.
They're supporting oral cancer cause, we're supporting their patients to help them if they need the financial help, and it's helping us get the funds to the right patients that need that help.
That's right, and we do vet those patients and check their medical and talk to their dentist and their healthcare professions. A lot of people ask that question, and it has been a win-win. The Bubblegum Challenge created the awareness, and they created people they know that need help.
Absolutely, absolutely. So, you know, the thing that we want people to know is they can go to our website, sign up for the Bubblegum Challenge, learn more about how we help patients if they have patients that need assistance. And so if they can go to our website and use those resources.
And we provide the brochures and the tools. And one of the things I love most is every patient leaves with a Got Mine sticker. They go back to work and people say, what'd you get? Your vaccine, your flu shot? No, I had a complete oral cancer screening.
Yeah, I love that too. That's one of my favorite things as a marketing person, you know.
Right.
Well, I'd like to thank Patient Prism for hosting us today and supporting oral cancer cause and always being one of our biggest champions.
Thank you.